So as therapists, how we might see this in our office with clients, you might see them move into one of those survival states, a state of protection. You might see sympathetic mobilization come online. You might see them begin to get a little agitated. They're speaking, get a little faster, a little louder. You feel the energy coming at you. Or you might feel them saying, oh, I need to get out of here now. So sympathetic has that driven energy behind it, whereas dorsal, that system of collapse and disconnection, that disappearing, really feels as if that client is just gone somewhere beyond your reach. And you can feel it as I talk about it. You can feel the system is moving into more of a disconnected place. So then let's come back to ventral, that place of connection. And you can feel, oh, nervous system is right here with me. This person is here with me, and we are safe enough and engaged enough to enter into a therapeutic relationship and do the work that we want to do today. And so really to assess those states, both therapists being able to watch a client move in and out of those states, but especially for a client to be able to begin to feel those state shifts for themselves, is the essential first part of a polyvagal informed therapy practice.